Good afternoon, good evening, or good morning, depending on where you're at, and welcome to another MOAA webinar. Today, I'm going to go through and review the most popular VA benefits. I know I get asked a lot. No, we do not provide the slide decks. However, you will receive a recording. If you registered for this event, you will receive a recording within a couple of days that will have an email that will have a link to the recording that will be available for the next 30 days or so. And then we typically, about 2 weeks afterwards, we post this to our website. Because it's VA, you don't have to be a member to access any VA type or VSO type materials. There is going to be a short survey at the end, so please, as you check out, please give us some feedback on the things that you'd like to see in the future. I'm Paul Frost. I've been with MOAA, started as a VSO volunteer, but I've been with MOAA on the staff since 2015. I'm a benefits counselor. There are two of us, financial and benefits counselors. There's two of us, myself and my colleague, Lila Quintiliani. So when you have questions that if our member service center can't answer them, they'll send you back to one of the two of us. So we're not a deep team, but we have pretty good knowledge on all of our military and VA benefits. We work at our transition center. We have two other colleagues that work in the transition center with us, and they handled the career side, people transitioning from military to the civilian career. MOAA's primary interest is in advocacy. We have 10 registered lobbyists who are working up on Capitol Hill to protect our earned benefits. And we're pretty well known up on the Hill. In 15 straight years, we've been named as one of the Hill's top lobbyists. So the big things that we're looking at: military compensation, concurrent receipt, SPP and DIC, TRICARE fees, and veterans health care are top priorities this year. We have two charitable foundations: the MOAA Foundation, which allows us to do events like this and then to go around the country. I speak at Retiree Appreciation Days. I'm going up to Fort McCoy end of next week. So any donations that go to either of our foundations are put solely. We don't take money out of those donations to pay salaries. Everything that goes into those foundations goes towards what we do with them. We do have a scholarship fund as well. They're typically $6,500 up to $6,500 in grants in interest-free loans. If you've had a federal student loan before, you know that's at 7%. So interest-free loans with a pretty easy payback schedule. So typically we give out about $8 million a year. Some of them is in grants. Most of it is in interest-free loans. I want a special thanks to Delta Dental, who helped sponsor some of our webinars. I covered a little bit about MOAA again, but we would be most pleased if you would consider a MOAA premium or life membership. Here's our upcoming calendar of events. We have a virtual career fair near the end of the month that's going to be featuring on the science, technology, engineering, and math, STEM. Also, what engineering specialty is right career for you. One of our transition webinars, what a looming recession means for your job search, middle of August, and then exploring academia and higher education careers, if any of those interest you. You can see all of our posted and registration pages on our events page on the MOAA.org website. A little bit for asking questions today. So you'll see if you use the question mark, the orange tab, you can enter a question. I'll see it in my Q&A box, and we'll get to those at the end. We do have a limit of how long we can go. We program this for an hour, but if I can go a little bit longer, if we still have a lot of questions that are being asked. And again, you just type your question in, and then I'll read them. You won't be able to see them, but I will read the question at the end when we're going to go through it. Here's today's agenda. I've got a lot of stuff I want to try to go through. The first thing I want to do is look at the VA reports. Every year they publish a report. So this is a characterization of claims, of how they're made up, how many are pending. And this was right as the pandemic was starting, so about 373, and the total backlog claims. Backlog claims are sitting in the system for greater than 125 days. Since they had come down in March of 2013 of a high of backlog of over 600,000 claims, they had stayed pretty much relatively under 100,000 for from 16 till right to the pandemic. So what happened at the, where does it stand at the beginning of this year? The backlog had gotten up to 260 and total claims pending 625. And then where was it as of last week? So they've whittled it down. There's still a lot of claims in the system, but they're slowly working away at the backlog. And they're predicting that by middle of next year, they should be back in that average of, under 100,000 in backlog. Here's another way to look at it, average days to complete. So this was as the pandemic was happening, under the goal of 125 days for both not fully developed claim. FDC means fully developed claim. That means you've sent everything in. And then non-fully developed claims take a little bit longer because you're usually asking the VA to go out and get some records. And then where did it stand at the beginning of the year? The fully developed claims were still under the 125-day goal. And then where was it as of last week? Creeping up a little bit, but they're still getting them done within the goal. But the non-fully developed are taking a little bit longer. Partially that was because of a big backlog at the National Archives in St. Louis. Okay, in fiscal year 21, how much money did the VA shell out? In compensation, it was $111 billion. Pension and burial, you can see there. Education, they spent just over $10 billion on education, the majority of that being the post 9/11 GI Bill folks. How much insurance, home loan guarantees, you can see there. Veterans readiness and employment, VRE over $1 billion, and then transition and economic development. So a total of over $128 billion in just VBA. That doesn't include VHA. What are the numbers? Just under or just over 55,600,000 compensation claims or recipients were, and then that also includes the DIC recipients. How many pension? Pension is for indigent veterans. Fiduciary is how many recipients can't control their money and need have a fiduciary monitor their money for them so they're not getting ripped off. You can see over 800,000 education benefits, insurance. There are just under 6 million veterans using VA insurance programs, and then you can see over almost 1.5 million home loan guarantee. VR&E, Veterans Readiness and Employment, that's an underused benefit. I think I do talk about it a little bit later, but I'll just mention here now. That's to get you, if you have disabilities that don't allow you to take your military skills into the civilian workforce, VR&E is meant to train you to go do something, and then they help, in the employment part, they help you get a job after you finish that training. If anybody had an e-benefits account, that was sundown at the end of last year. va.gov is the new website. If you hit sign in, it will allow you to do 4 ways. Login.gov at the top is the latest way that you can access government websites. So I use DS Login, but I went ahead and got a login.gov website. And when you use one of those websites, and if you're using VHA, My Healthy Vet, it works as well, but it allows you to go through the VA's website to get at other government computers as well. Okay, so then you come back and you can see I'm logged in up here at the top. There's a lot of things that you can access here on the va.gov website, whether it's education. If you look under the records, you can put in for a veteran's ID card. You can get access to your medical records. You can download any of your VA benefits letters if you've lost them, changing your address, getting your DD-214, and then looking up at the disability side, what you can do there, checking your claim status and appeal status if you're not using a VSO. And then on the top left, your healthcare. So scrolling down a little bit further, it gets a little more specific on certain programs, but there is a ton of information on va.gov. So if you haven't been to that site, I recommend use it. I refer to it all the time when I get asked questions. Okay, the PACT Act, and I'm going to go into more detail on that a little bit later, is set to be signed at 10 a.m. tomorrow by the president. So I'll get into that a little bit later. But I just want to show you, last year, 14 new bills just the Congress is looking out for veterans. Each year they've got multiple bills. You can see this year we started out with 38 in the House and 30 in the Senate. The biggest one being the PACT Act, but not all of them always make it through. But every year there's a dozen or more bills that they're looking at improving benefits for veterans. So I'm not going to go into all the different ones, but just show you here that there's a lot going on there. Okay, the PACT Act stands for the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxics Act. Okay, there are 3 current burn pit presumptive conditions: asthma, rhinitis, and sinusitis. When it's signed tomorrow, immediately they'll add any head, neck, respiratory, gastrointestinal, reproductive, lymphoma, lymphomatic cancers of any type. Also, they'll add kidney cancer and brain cancer, skin cancer, melanoma, and granulomatous disease, which is a blood-borne type cancer. At the Secretary's discretion, other things can be added over time, and that is the plan. So, these will be the ones that are automatic right away. But as we learn things, how the body that has been exposed to burn pits, develop different diseases. We've only gotten out of there in the last year or so, but people have been exposed since we went the first Gulf War and then the second GWAT. So we're still learning, and the same thing happened with Agent Orange. Things get added over time as we have more scientific evidence that says that that things need to be added. So this will impact other presumptives. It will add hypertension. I don't believe it's going to add it right away, but eventually it will add hypertension to Agent Orange presumptive. So the PACT Act. Okay, and you can read plenty about that if you want more details. We've written numerous articles, our government relations team, and you just go to our website and go to the search engine and hit PACT Act, and you can see a lot more details if that's what you're interested in. Okay, VA Disability Compensation Program. We know that military service is harder on our bodies. So when we leave service, we're at a little bit of a disadvantage to our civilian counterparts who don't have to, haven't served and haven't had the stresses and the injuries that we're susceptible to by serving. So this compensation program was meant to compensate us for that military service and the disadvantage. Typically, basically, if you have to have an honorable discharge to access most VA benefits, they are looking at, and the VA is assisting for those who got other than honorable or general discharges because of TBIs, PTSD, those types of things. If you want an upgrade, go to the VA's website, va.gov, and you can find help from the VA in getting your discharge, characterization of your discharge upgraded. Okay, you must have evidence of an in-service injury or disease. Okay, it has to happen while you're in service, or the disease can be developed within 1 year of leaving service. That can be service-connected. You must have a medical nexus, either a direct service connection, it happened while you were serving and not at due to your own misconduct, or it could be aggravated. Say you came into service with slight asthma, and then you were exposed to a burn pit, and now you have severe asthma. That would be aggravation. Secondary service connection would be, say you had injured your knee, and your right knee, and by favoring your right knee, now your left knee's got problems. That would be a secondary service connection. And then presumptive service connection, we just went through them: the Agent Oranges, the Camp Lejeunes, and now the PACT Act. Again, it doesn't have to be in combat, wartime, or training related. Again, if you're playing, you're on active duty, you're playing intramural basketball, and you break an ankle, and it need pins in there or a rod, that would be a service connectable. Because chronic versus acute, you break your arm and your arm heals, there's no residual disability to that. That would be an acute and not service connectable. You break your arm and you have to have pins or a rod put in you're going to have residual hardware in your body, and therefore that would be considered chronic and service connectable to whatever range of motion you're not be able to have. Most of your evidence is coming from your service medical records. However, you can have buddies or family members write statements supporting your claim of what you think your disability is. Or you can go back and use your logbooks or any safety reports that were written about the incident. If a newspaper article was written, or if you sent back letters to family and friends. So again, the majority is your service medical records, a clear diagnosis of what it is that you're claiming. But I did use buddy statements to help an individual get. I didn't think it should be required because he had the sleep apnea test within the first year of leaving service, so it shouldn't have been denied to begin with. But I said, hey, did you deploy to Iraq or Afghanistan? He said, yes, I was in Afghanistan. I said, did you get yelled at all the time or have pillows thrown at you by your roommates? And he said, yes, I kept them up all night. So 4 of the 5 that he roomed with wrote buddy statements, and he got his claim approved. Okay. The rating for scheduled disabilities, this publication here, not every possible disability or disease is located in there, but the rating officials have been trained to find the closest one to whatever condition it is you're talking about. You can go to our website, MOAA.org, VSO webinars or /VSO, and you can see some of the materials that we provide. MOAA terminated its claim and appeal services in 2017, but we still try our best to provide information and advice on the VA disability compensation claim process. Okay, the types of claims. If you're getting ready to leave service, benefits delivery at discharge, you're going to submit that between 90 and 180 days remaining in service. If you submit it 89 days or in, it's just going to sit there in the system until after you're out. The only difference between a BDD and a fully developed claim is the fully developed claim includes the DD-214. So if you're getting ready to leave service and you are submitting a BDD, you got to remember to send your DD-214 as soon as you get it uploaded into the system, because they will not adjudicate your claim until they see that you've gotten an honorable discharge. So once you've submitted the BDD, you got to be available for the next 45 days. When a claim reaches the top of the rating official's inbox, he or she will go, okay, I need a medical exam for that, and that. They'll send it off to most likely the contractor. The contractor will contact you, either send you a letter or call you and tell you, okay, we've set you up for appointments on these days. It could be all in one day. It could be spread out over a couple of days or a week. So then once the claim is, they're called disability benefits questionnaires at the CMP exam, compensation and pension exam. Once the rating official has uploaded the DBQs, disability benefit questionnaires, just waiting for it to get to the top of the rating official's inbox, and then they'll take a look. Those DBQs, disability benefit questionnaires, are like an interview. So you want to make sure that you reviewed your claim before you go in for your medical exams. So you're not telling them, they say, hey, you're saying your knee's bad, that you got a bum knee. How's it feel today? Oh, it feels good today. But you want to go ahead and explain, I'm not telling you to lie, but you want to say, hey, but it prevents me from, I can't run anymore, or I can't play tennis, or, with my back, I can't sit for long periods of time. I have to have a stand-up desk, or I can't take long drives. So you want to make sure that you remember what you submitted, and then you're being honest and telling the full picture to the person who's doing your medical exam. Fully developed claims, if it's your initial claim, you want to have a complete set of your medical records, your DD-214, and again, the goal is 125 days from when they receive it. And typically there's no other evidence for you to submit. Traditional claim, hope nobody's doing these anymore, but if you don't have your medical records, you can ask the VA to go get your medical records from the archives or from any hospitals that you may have visited. Typically though, if you're using a VSO, the VSO wants to see your medical records. I had an 85-year-old retired admiral come and finally wanted to do a claim, and he didn't have his medical records. So I said, well, hey, before we send in a claim, I want to see what your medical records say. And so we went to the archives. It took 6 months to get them, but we eventually put in a claim. So traditional claim, hopefully you're not doing those. So then after your original claim, whether it's a BDD or fully developed claim, any subsequent claim is either a supplemental or a claim for increase. Once you have your disability rating, typically the adjudication letter says, hey, we've service connected you for this, and it's at this compensable level, and usually has the details of that level. And then typically they used to, I haven't seen a notification letter in a while, but they used to have the next highest rating underneath that. So if you think, hey, I think I've gotten to the next highest level or higher rating, or you take it to your doctor, hey, do you think I'm at that level? And then you can put in a claim for increase. If something was denied or you have a secondary condition from a service-connected condition, any claim after your first claim is called a supplemental claim. Okay, before the Appeals Modernization Act of 2017, your first appeal went back to the regional office called a Notice of Disagreement. That would take 2 to 3 years. Then if it came back and they still didn't approve or you still disagreed, then you could go to the Board of Veterans' Appeals. That was taking 2 to 3 years. If the board came back and denied your claim, you could go to the Court of Appeals for Veterans Affairs. So we said, hey, this isn't working. It's taking too long to get answers for veterans. And so the VSO community, MSO community, and veterans convinced Congress to pass this act with working with VBA to make sure that it was all set up correctly. So within 1 year of a decision, you have 3 options. Your supplemental claim, say if you disagree, but now you've had more evidence to submit, you can go ahead and do that again. You can see they were taking about 75 days back in the spring. You could do a higher level review, but it's going to go to a more senior rater. A lot of veterans don't like this one because they don't trust the regional offices. So that's why we added the opportunity to go straight to the board. Again, the first 2 are 125-day goals. If you go to the board, the goal is a year. If you ask for a hearing, it may be a little bit more than a year, but it's a lot less than the 3 to 4 years it was taking earlier. Again, how do you get your service medical records? Typically, you've got to give them 30 days, so don't expect them to produce it right away. If you've already retired, then you should have gotten one when you left. So then you need to just get whatever records you have since you retired. If you're doing a supplemental claim, you don't have to resend all of your medical records. You just need to send the new stuff from the last claim. Okay. And again, if you want to get from the archives, if you don't have your records, submit an SF-180 via the mail, or you could go online and request your records. For the first one, for leaving the service, if you're being seen for mental health, they are usually kept separately. So if you're putting in a PTSD claim or a TBI claim, depression claim, make sure your mental health records get sent to you before you submit your claim, so you can have that with it. And if you were overseas or you're in a place where there's no military treatment facility, anything that you've seen out in town, if it helps with your claim, you need to make sure that it's included in the claim itself. Again, MOAA always recommends the use of a Veteran Service Organization, or VSO, when you're doing your claim. There are 40-ish nationally accredited veteran service organizations like the American Legion, DAV, VFW, and then most states, some more robust than others, participate in a county VSO program. So you just Google your state's Department of Veteran Services to see if there's a county VSO nearest you. County VSOs may have more information or better information than a nationally accredited VSO on what state benefits your rating may get you. So they've all been trained to protect your personal information and your medical information. When I did my interview with our president and CEO back in 2014, it was Admiral Ryan, and he basically just said to me, Paul, I'd never want to be on Capitol Hill and have John McCain ask me about a data spill. So they also use a case management system to help organize your claim. Your claim isn't just one form; there are multiple forms, and I'm going to show you them here in a few slides. So, but they make sure, and they're familiar with these forms. They deal with them every day, and so they know what needs to be checked and filled in. Again, after some training and after some experience of going through medical records, they know what you need in your medical record, whether it's clear or not that you have a diagnosis for something that is service connectable. Some things that we get, like high cholesterol, is not a service connectable disability. And again, they'll explain the service connection system to you. There are three important milestones. Getting a service connection, which at a non-compensable level, meaning 0%, is important, because if that disability gets worse as you age, you can get that put in the claim for increase. So 0% is just as important, getting that service connection. Then at 30%, you get additional compensation for your dependents, and I'll show you that when I show you the rate table slide. And then at 50%, if you have 50% and 20 years or more of service, then you're eligible for concurrent receipt, and you won't have the VA waiver applied to your retired pay. Again, I'm going to talk about VA math here in the next slide, I believe. It's always rounded down. I have people come to me, I'm rated 75% by the VA. Well, no, you would be rated either 70 or 80%. The VA rounds up or down to the nearest 10%. And again, the biggest thing, when I first started doing claims, a lot of people would come in and say, hey, that my claim got rejected. And I would look at it and I would see, well, because you didn't fill this part out correctly. So your VSO makes sure that everything's filled out and your claim is a complete claim. Sorry, this happens when I'm sitting for a long time. My light goes off. Okay, so again here, some of the nationally accredited VSOs, they're going to ask you to sign, we call them familiarly the POA, or power of attorney, but it's a representative request. You're telling the VA that this VSO can represent you, and you can give them access. You don't have to you can give them access to everything. Like you can restrict access to certain things. There is no cost for claim services from a VSO, whether it's a county VSO or a nationally accredited VSO. They do not charge. There are a lot of snake charmers out there that are now starting to advertise on TV, and they're going to take a big chunk of money of your compensation when your claim is adjudicated. So please don't use them when you have these free resources out there. And again, Googling your state's Department of Veteran Services, you can find if you have a county VSO. I think there's only one state that doesn't have a county VSO, and that's Alaska. But some states are more robust. States that have a lot of especially retirees, like Florida, Texas, and California, all have very robust county VSO programs. Here in Virginia, Northern Virginia, we've got a pretty good one. There's down in the Tidewater area as well, but Maryland, not so much. Okay, your claim has now gone in. What happens, what I told you about is it's going to get to the top of the rating official's inbox. He or she is going to assign medical exams. You get your medical exams done through DBQs, disability benefit questionnaires. Then it goes back into the system. Especially if you went to a contractor, they're going to get them in right away because they don't get paid until they enter their DBQs into the system. And then it rises back up to the top of the rating official's inbox, and then they'll adjudicate based on what the DBQs and your medical records say. Again, you'll get a VA notification letter, and that notification letter, it has your appeal timing on it. So you have 1 year from the date of that notification letter to appeal any of the decisions that are made: service connection, denial, or level of compensation. Okay, VA math. I've had people tell me, come up to me and say, hey, I should be rated 400%. Well, you don't add up all your individual disabilities. So my example here, if you looked at it, you just say, hey, that should be 50%, right? No, you only have one 100% able body, okay? One 100% able body. So the highest rating goes against your 100% able body, so you get the full 30% in this example. The next one, you subtract from that 100%. So that next highest, which is 10%, only goes against a 70% able body. So you only get 7% for that, and you can see 10% out of 63. Then you add them all up, and it comes, in this case, to 43.3. 44.9 and below, they round down to 40%. 45.0 and above, they would round up to 50%. If the first two, say, were both your knees or both your shoulders or both your elbows, there's called a bilateral factor. When you have a disability rating for both joints on both sides of your body, they will add a bilateral factor, and it's computed typically on a percentage of the combined those two combined ratings. So say it was 1.7% here. That just gets added to the 43.3, and that takes you to 45.0, which would bump you up to 50%. So that can bump you up to the bilateral factors can bump you up to the next highest level. I'm doing it the long method here. You can do it that way, or you can go to that link, and there's a charts that you can go in. You just keep entering all your different disabilities, and it'll spit you out an answer at the end. Okay, what do the different forms claim? So if you haven't submitted a BDD and you're after 1 year of service, because if you submit it within 1 year of leaving service, it will go back to your exit date or your retirement date. After that, and for supplemental claims or claims for increase, you can file an intent to file, VA Form 210966. When the VA receives the ITF, intent to file, that sets your claim date. You then have a year to submit your claim, and once the claim is adjudicated, it goes back to the date that the VA received the ITF. I already mentioned this 2122 for the power of attorney or the representative request. The main claim form is the 526EZ. That's the fully developed claim, or you use that for your BDD as well. The next, and why I highlighted the next form, statement in support of claim 214138. That is like a blank piece of paper. It's got your, you're putting your name and stuff, information on there, but otherwise it's a blank sheet of paper. Some VSOs use these, some do not. I recommend that this is your opportunity to talk to your rating official. They're going to read all of your medical records, and they're going to see what you're claiming on your 526EZ. But this is your opportunity to tell them the who, what, when, where, and why of what you're claiming. Okay, you might pull stuff out of your medical record. Anytime an MRI, I would take what the radiologist said, and I put that on the 4138. If you've looked at your records, they just repeat and repeat and repeat and repeat. Now, again, they're supposed to look at every page of your medical record, but if they read this first, it gives them a sense of all the different disabilities you're claiming and the who, what, when, where, and why. When you were had an injury, how it impacts your daily life, what kind of medications you may have to take for it. All of that information, if you take the time to put that together with the help of a VSO, I think you're going to be much more satisfied with your initial claim adjudication than if you don't use that form. If you have dependents, that's 686C. If the kids are 18 and going to college, you have to submit a 674. And then again, your medical record and separation physical, if they're still doing those. We used to always put marriage certificates, divorce decrees, all your you're going to need all your children's SSNs and your spouses. And then they want to know what your separation pay for retirement. I mean, they're going to do an adjudication if whether you're eligible for concurrent receipt or not with DFAS or the Coast Guard Pay and Personnel Center, but they still want to see that that's part of the form and where they send your check. I've seen them where they'll hold up a claim because you didn't put where you want the money to go to. They don't do checks anymore, so you got to give them a place where to send your money. Okay. 2 types of concurrent receipt. You may be eligible for both, but you have to tell the pay agency which one you want because you can't get both. It's one or the other. We have a great publication that gets into the details. This is pretty straightforward for active duty retirees. It becomes much more complicated, and I did in this spring, I did a concurrent receipt one where I tried to explain for if you're a medical retiree or you're a reservist who is medically retired, it gets a lot more complicated to calculate what your concurrent receipt should be. Okay, starting in over there without getting concurrent receipt. So you are less than 50% rating, 40% or less, or you have less than 20 years of service if you are medically retired. So what happens is whatever the VA compensation is, they will subtract that from your retired pay. And then again, why you want to do that? I've had people say, I'd rather not have it. Well, you're reducing your taxable retiree income, federally taxable, state taxable in some states. You're reducing that to get tax-free. Any time the VA is paying you, that's going to be tax-free. Okay, so now in the middle there, if you have 20 years of service and a 50% or higher rating, you don't have the VA waiver applied to your retired pay. Now, I've had people say, hey, I should be getting concurrent receipt. Where's my CRDP check? Well, there is no check for CRDP. It's just not having the VA waiver applied to your retired pay, so you get full retired pay. Now, CRSC, the way they do that is if you're eligible for it, you have to apply to your service. Your service will look at your VA rating and decide this one's combat related, this one's combat related, this one's combat related. Then they'll do the same math to come up with what your combat rating is. The general rule is that if your combat rating is the same as your VA rating, then CRSC is going to be the most advantageous. Okay, and DFAS, or the Coast Guard Pay Agency, will do that analysis for you and then tell you, but then they give you the opportunity because they only know what they're paying you. If you're a high income person, that you may have a split between the two and still have CRSC being the most advantageous. So what happens is whatever the VA rating is, they will waive your retired pay for that amount. So that's your net retired pay. You get your full VA compensation. And then whatever the combat rating is, you'll get a tax-free check from your service back for whatever the combat rating is. And again, if the two are the same, always going to be CRSC. If there's a split, you need to run the numbers. You'll get a letter from DFAS or Coast Guard, and that says, hey, you're eligible for both. We think this one's the most advantageous. You have 30 days to tell us if you want to switch to the other one. You've run your numbers, and they were right, so you stick with what they had. And then each year, if things change, like say you get a new rating, things may change. Maybe now the combat and VA rating are the same, and you want to switch. And so you have it at the end of the year, beginning of the year, you have a chance to switch to the other concurrent receipt. Here are those rate tables I talked about. You can see up on the top left. Remember I said that you have to be 30% or higher to get additional compensation for your dependents, whether that's your spouse, your children, and you may have parents who are dependents. The VA will give you additional compensation if you have dependent parents. So those were tables with no children. Here are the tables if you do have children that are still eligible to get additional compensation. Again, the money always comes to you. You're just getting it because you have additional dependents. These are updated each year by COLA, and it reverts back to December 1st of each year for some reason. I'm not sure why they did that, but that's the way it works. And you can find these, and you can find previous tables by just Googling VA rate tables, and you can put a year in there if you want to see previous year's rate tables. These are the ones in effect for 2022. Oh, sorry, I must have had a repeat there. Okay. I get asked, what happens to my VA compensation when I pass? Does my spouse continue to get it? No, VA compensation is for you. However, if your service was the cause of your death, then your spouse may be eligible for dependency and indemnity compensation. Your children may be as well, but typically it's a surviving spouse. So it can be an active duty death. It could be caused by a service-connected disability, or if you're rated 100% permanently and totally disabled for the last 10 years of your life, then no matter what kills you, your spouse will be eligible for DIC. You can see tax-free. I'm sorry, I left last year's rate. You can see what it went up 5.9%, but 1437.66 for this year. That is COLA protected as well. There's an additional stipend if you were 100% permanently and totally for the last 8 years of your life. That's about an additional $300 on top of that. I get asked, hey, most pensions or survivorship is based on 55%. So they're looking at this and saying, hey, if you if you're 100% with a spouse, that's $3,500 in 2022. 55% of that is going to be higher than 1438. So they're looking at possibly increasing the DIC rates to reflect 55% of the compensation that the veteran was getting at the time of his or her death, with the being no lower than with the current 1437.66. So that's being looked at, and I don't know if it will pass anytime soon. But again, DIC. Now, we were successful a couple of years ago in getting the removal of the SBP DIC offset. That passed in 2020. They're phasing it in over 3 years. So just an example here, in 2021, 2/3 of DIC rate, which as you can see here from the previous slide, was 1357. So 2/3 of that is 905. This year, 1/3 of 1437 is 479, and then next year the offset will be totally eliminated, and surviving spouses will receive full SBP and full DIC. You can see what SSIA is there is Special Survivor Indemnity Allowance, and that was Congress's way of giving something back to this egregious tax. And so that's been COLA protected since about 2015. Okay, let's talk VA healthcare. Something happened to there we go. So VA healthcare, you must enroll. There's talk that they're going to automatically enroll everybody, but they haven't started that yet. But you're going to enroll, and they're going to put you in a priority group based on your VA disability rating. If you have no VA disability rating, then they will do a needs test. And if you do not have, if you're making above the poverty level on as your income, the poverty level for where you live, then you will be listed as priority group 8. As we were getting after 9/11, as we knew we were going to be going to war, the VA said, hey, we're going to have a lot of veterans coming back, soldiers, sailors, airmen, and Marine coming back that are going to need VA health care. And so this was when, about 2003, they decided, hey, if you don't have a VA disability rating, you're not a non-disabled veteran. If you don't have a need below the poverty line, then we're going to exclude you. As COVID hit, this irritated a lot of veterans because they wanted to get the vaccine through the VA. So it was about a year into COVID that President Biden said, hey, priority group 8 veterans can get the vaccine, and their spouses that get the vaccine from the VA. Okay, again, if you're 50% or higher, you're priority group 1, you can get all of your healthcare needs from the VA at no cost. 30 and 40 is priority group 2. If you're a lower priority group, you definitely can get any service-connected disability health care needs handled at no cost from the VA, but other things you may have to pay a copay for them. There's a combat veteran exception up to 5 years with no cost. The Mission Act allows, if you can't be seen by the VA or there is no VA clinic or hospital near you, the Mission Act, which is an expansion of the I forgot it off the top of my head. It's an expansion of the community for community care, getting out into getting care within limits that they've established. Hearing aids is a big issue for folks. TRICARE and Medicare do not cover hearing aids. There is, I don't have it on these slides, but there is a DoD program called RACAP, Retiree at Cost Hearing Aid Program. You can Google that and find the webpage where you may get access to at-cost, retiree at-cost RACAP hearing aid program. But the VA may be a way, if you have, especially if you have a rating, to be able to get hearing aids through the VA. And supposedly they may not be the top of the line out every year, but I've talked to folks and said, hey, the hearing aids from the VA are good. Again, the Mission Act gives veterans greater access to health care outside of the VA community. Again, routine care, if you have a 20-day wait or 30-minute drive, and then specialty 28-day wait. So, and then it expanded for caregivers, although the VA had a bit of a problem in that they weren't consistent. Veterans Health Administration wasn't consistent in evaluating veterans and whether their caregiver or the disabilities of the veteran enabled the caregiver to get into the program. So I think I've got some more information here. So you can go on the va.gov website and look at the caregiver support program if you or your spouse are in a caregiver status. And then there's this page where you got all of the different PCACFCs, and you can see all the fact sheets associated with that. So if you're interested in the caregiver program, I didn't want to go into all the different detail here, but you have access through the va.gov. And then they have a caregiver calendar, so where they're putting out information and news on the caregiver program. Okay, Forever GI Bill. You have to have serve an additional 4 years after you make an initial transfer. You cannot do this after you've left service, okay? So yes, it's for those who served after 9/11, but if you didn't, if you weren't in service in 2009 when this came online and were able to serve 4 additional years, you're not eligible for this program. So the forever part, if you left service after January 1st of 2013, then it never expires for you or your spouse. Your children still need to use it before age 26. If you left prior to January 1st, 2013, that was me, it expires after 15 years, okay, for both you and your spouse. You have to use it within 15 years of service. Any Montgomery GI Bill that you left service with expires after 10 years. Again, 36 months, people say, well, wait a minute, 36 months, that's 3 years. Well, most school terms are 9 months long, so 9 times 4 is 36. You can see it's capped. Each year it goes up by a certain amount based on what costs have gone up. It doesn't follow COLA, but they do an average of increases at universities. So this is the top of the line for private schools. Public schools are typically going to cost less, except for master's and doctoral programs. I'm sorry, I have an old slide here. It went up to $26,380 for the 2022-2023 school year. The VA pays the school the tuition and fees, and they only pay you for your monthly housing allowance if you're going at least more than half time. And they'll pay you the book stipend each year, $1,000 a year. So the Yellow Ribbon Program, that's now eligible for active duty and their spouses as of August 1st of this year. The Yellow Ribbon Program, what that's designed to do is mainly for public schools that have costs above this for master's and doctoral programs. I don't know of any public school that has over $26,300 for undergraduate work. But what they do is they'll say for each different types of program, typically undergraduates, it's for every undergraduate, and it will pay half. The school will pay half, and the VA will pay the other half. Or if it's a specialty program, typically they may say we only have 10 spots for this, and they may say it's for $5,000. So they'll pay $5,000, the VA will pay $5,000, and then whatever's left is on the student in themselves. You can use it at vocational schools. You can get it for flight training. You can't get your pilot's license, but you can get additional ratings through the VA using the GI Bill. You can use it for correspondence courses, apprenticeships, and on-the-job training. Again, the key thing was that you have to be serving for an additional 4 years after the first transfer. If you transferred and then after the transfer you were put into the IDA system, they're looking at medically retiring you, then if they put you out before 4 years, then it's still a valid transfer. If you were already in the IDAS program before you transferred a month's worth, any benefit to your kids, then it can be invalidated. Memorial benefits. There are lots of national cemeteries. Some of them are full. I know Point Loma, when I was out in California, Point Loma is full. There are others that are full, but you can go to www.sem.va.gov and you can see the list of them. Again, all veterans with qualifying discharges, typically 3 years, are eligible for burial. So they pick up the shelter, the grave site, the grave liner, opening and closing the graves, and a headstone, and then perpetual care. So, I've heard of VA cemeteries that don't have great perpetual care, but most of them do. If you're going to go into a private cemetery, then you can get a headstone or marker, but they won't do it for your spouse. Your spouse is also eligible for any of the national or state cemeteries as well. People want to know beforehand if there's a form there that for eligibility. Basically, if you have an honorable discharge on DD 214, you're probably going to be eligible. Again, we have a publication for that. Okay, this is big news for a lot of folks. Want to be buried in Arlington National Cemetery. The new rules, if they do go into play, so they came up with this new plan. They put it on the Federal Register. It's still there. I checked, so if you want to use that link, it's still there. If you want to read it. But here's the new rules. You have to have been killed in action, a Silver Star or above, if you've received a Purple Heart, or if it's a combat-related death, if you were a POW, and then the President and Vice President of the United States. Right now, the Secretary of the Army is working off all the comments from the Federal Register, but they do know that Congress is interested in this because there was an outcry that everybody who up to this point, if you were eligible, should be grandfathered in. I do not know if the Army is going to start with these new rules or whether they're going to look at this again. We do also know that they are looking for the next national cemetery. Once Arlington is full, what's going to be the next national cemetery? There's talk that possibly the Marine Corps cemetery down in Quantico. We've heard that they're looking at maybe doing it somewhere in the middle of the country, maybe in Colorado or out west, California or Oregon. I'm sure it will be announced, and MOAA will put that out as soon as we get word of where it's going to be. VA Home Loan Guarantee Program. Again, the VA refers to it as a VA Home Loan Program, but it's Home Loan Guarantee Program. You're getting your loan through a private lender. The VA is just guaranteeing the portion of the loan. It may be used to buy, build, or refinance an existing home. So typically, if you're not using it for a house that you're not going to occupy. Again, you can sell it later once and pay it off. But typically, it's going to be a home that you're about to occupy. There were limits pre-COVID, so they basically said now there is no limits unless you already have a VA home loan. So if you already have a home loan, around most of the parts of the country, they would subtract whatever is left on that loan from $647,200 to get a maximum for a second loan. If you live in a high-cost area like the National Capital Region, they would subtract what's left on that loan from $970,800. Again, the advantages of this, I only used it for the first time for a refinance, actually in the middle as COVID was gearing up. But the advantage, no down payment, no primary mortgage insurance. They limit the closing costs, and there's no penalty for early payoff. So you want to go to that get that certificate. You can apply online through the lender as well to get your certificate. And they send them out pretty fast. I think it took less than a week to get it. A key thing here is if your funding fee is waived if you have a VA rating. So if you're getting out of the service and you're looking to buy a home, you're going to move to a new location or whatever, or you're looking to buy a home, you don't want to close until you've sent in your VA disability compensation. If you're closed and you've already got your rating back and you have at least 10% or higher, then there is no funding fee. If you don't have your claim adjudicated by the time you close, you're going to have to pay the funding fee. But then once you show them that, hey, I have a VA rating, then they'll refund the funding fee. It's not chicken feed. So, think about, some of the houses are, around high cost areas. If the first use, if you're not putting anything down, 2.3% funding fee. So, and then second one's 3.6. So that can be a big benefit by having your VA claim done. Okay, replacing SGLI. Veterans Group Life Insurance, you must apply for this within 485 days of leaving service. And to have it with no medical exam, you have to do it within 240 days of leaving service. You can see that they went in five-year increments. I've asked the VA, hey, most people want to get out to a certain age, when they think there may be empty nesters, whether that's 65, 70, why don't, and then you can you can space them out. But the VA said this is their program and they're not changing it. So the rates did go down actually last year. And so, if you're interested in this, you got to get it before 240. They are talking about, they haven't increased this in over 10 years, 15 years probably. So they're talking about $500,000 benefit. So we may see that soon. As a price comparison, I did 50-year-old healthy male and female at those heights and weights, non-smoking, through Policy Genius, and you can see the ranges there to get out a 10-year term, a 15-year term, or a 20-year term policy. So VGLI, a lot more expensive, but you may not be able to get open market if you're in bad shape. Okay, again, if you're leaving, you're not going to listen, stay for the Q&A. Please take time to do the survey. Remember, if we do not send you the slide deck, you will get an email probably in a couple of days that will have a link to the recording so you can watch it again. Okay, got lots of questions here. Let's go down to them. Without being specific, do you know when the proposed changes to VA disability rates will change? They change quite frequently. They're coming out with different ones for hypertension. They're coming out with adjustments to sleep apnea. So they're supposed to be implementing them now. You would be grandfathered in if you already had a rating for either of those two that I know off the top of my head. Then they would not adjust. But any new claims on those two specific ones that I know about are being implemented now. How does VA disability affect retired pay? Well, as I mentioned I know this question was typed in way before I had the CRDP, but I'll go through it one more time. You have to have a 50% rating and 20 years of service or more, and a 50% rating or higher to not have the VA waiver applied. If you don't have 20 years of service, or you don't, if you have a 40% or lower rating, then VA, whatever you're getting in VA disability will be subtracted or waived from your retired pay. For disability compensation, if the VA took over 14 months to make a final rating, i.e. went from 10 to 50 and finally 90, should the back pay include the difference not paid for the total period? Each time they make an adjustment, they will tell you what the award date is, and for that disability. And if the award date is previous from when you submitted the claim, eventually, yes, you will get back pay to that, for that rating to that date. They'll start paying you immediately from then on, and then it usually can take anywhere from 3 to 6 months as they do audits and talk with DFAS or the Coast Guard Pay Agency to decide what your back pay should be. Have you heard of the VA pushing the days to complete to out, say, an additional 6 months? I have not heard that. I sit in on VBA meetings with VSOs every month, and I have not heard that, Kevin. Carlos, how do I connect with a VSO rep to help me make sure I'm not missing anything? I heard preferably not have a VA rep, as the VA law at times is not the same as standard law. I'm not sure what you're getting at there, but there are, on some bases, there are VBA employees that will help you put together a claim. They're very good. They know what they're doing. However, once the claim has been submitted, it's in their bosses, it's in their program. They can no longer talk to you. Okay, so you want a status update of your claim, they can't talk to you. So while they're very good and their claims usually come back well done, if in the interim, you're not going to be able, and afterwards, you can't talk to them. So I always recommend people get a VSO first, a county VSO or a national VSO, and just use them. But if your only access is to a VBA employee, okay, that's up to you. You want to connect with them by you can find them through Google, VFW, DAV, any of those. Go to their national website, and usually the search engines will have you find a local one where you're living, or Google your state's Department of Veteran Services to see if there's a county VSO near you. 20 years ago, this is Julia, 20 years ago, I signed up for Montgomery GI Bill, the 24-limit contract. Do I qualify for the maximum monthly benefit for full-time student status? If you left service 20 years ago, your Montgomery GI Bill expired at 10 years, I'm sorry to say. If you're less than 10 years ago, then you would have to check. There's an education call center. You would need to call the education call center and find out the status of your Montgomery GI Bill. You could also go to the Mill Connect website, just Google Mill Connect, and I'll take you to that website. And if you have an account, if you've set up an account, you can go in and check it there. Hope that helps. James, is login.gov essentially a single sign-in portal for multiple federal? It can be. I believe it has two-factor authentication, however, but it is a way to get into multiple federal government websites. That's my knowledge of it. Julia, are there VA benefits I have to apply for before my effective retirement date? Are there VA benefits I have to apply for before my effective retirement date? Well, Julia, you asked about the Montgomery GI Bill. If you wanted to switch to the post 9/11 GI Bill, which if you're getting, I'm assuming you're about to get out, then it will never expire. First of all, you just need to tell them if you signed up for Montgomery and didn't use it, then you want to go ahead and say, I want to switch to the post 9/11 GI Bill. That will be part of your out processing. And then if you end up using all 36 months of the post 9/11 GI Bill, then you will get a refund of the Montgomery. If the secretary can add conditions, do future secretaries have the ability to remove conditions? No. Once my understanding, Wade, is that once it's on the list, it's not going to be taken off. At least I've never heard of them being able to take one off. Because usually it's been a lot of pain and angst to get it on the list. I've been told that if you submit a BDD, VSOs might not be able to assist in appealing claim. Local VSO is putting out guidance to wait until you are retired to submit your claim. I've not heard of. I'm not sure why. I mean, it doesn't. Again, we're in the transition business. One of the things we talk about is getting that claim done and out of your hair, because what are all the other things that you're doing as you're getting ready to retire? You're putting your resume together. You may be going for interviews. You're getting your wardrobe. You're getting business cards. You're doing resume and a bio. There's a lot of things that you're doing, especially in that last 90 days. So as long as you're getting it done within a year of leaving service, that's great, fine and dandy. I recommend to people, if you can get it out of your hair, if you can make sure you've gotten all your medical records up to date, that everything you're thinking that is a disability is in your record, and then just get it off your plate. But I could see why some are saying to wait. But again, thinking of all those things that you're doing as you're getting ready to leave service. Retiring within a year, 10 months, but have old DD-214. Would you use BDD? Okay. You have your old DD-214s, but they need your last one as well. So you can submit either a BDD, within that 90 to 180 days, or you can wait until, you get your next DD-214 and do a fully developed claim. It's really up to you. You can do it either way. I keep hearing that a female has undergone a total hysterectomy is rated by the VA. Is this correct? Yes, Lisa. A hysterectomy is a service connectable condition, or yes, condition. I don't know. I haven't looked up what the rating would be, but yes. How can I request from MOAA? Scott, MOAA terminated our claim services in 2017. Paul, is there a different process for disability claims submitted for someone who originally was in active duty, then went to the reserves, and then retired from the reserves? No, it's the same claim forms. The thing for anything that happened when you were in reserves has to have been while you were, active reserve. So, but no, the process is the same. For supplemental claims to increase, is there a risk they could downgrade your rating? Brian, once you have had a rating for 5 years or you're 50 years or older, they consider anything static. There are diseases, if you have a cancer or if you have a hip replacement, those are going to be variable. So typically you're going to be rated 100% while you're going through therapy or you're going through treatment for cancer, and then after you're in remission, then they will evaluate the residual disabilities associated with having that original cancer or hip replacement, whatever it is. So for your other ones, once you had them for 5 years or you're over 50, they don't go back and look. Can this be watched again? Yes, Jeffrey, as I've said, you'll get an email here in a couple of days that'll have a link to the recording. If you have been denied for claim of hypertension and appeal period has expired, will making presumptive under allow you to resubmit? Yes, Alan, it will allow you to resubmit. Have never submitted a claim. How long are they? 5 pages minus separately giving medical proof just to decide if I should do it myself or with assistance. Well, with instructions, the 526 EZ is over 10 pages. I think it's 11. So people can do their own claims. I just always recommend if you can be helped by a VSO, we recommend using a VSO. But is anyone, I did mine on my own, because I didn't know about VSOs when I was getting ready to retire, and then I became a VSO. Can you work with more than one VSO from Rick? No, typically you work with one and then you're not happy with it. The claim comes back, you're not happy with it, or you can't get back in to see them. You can switch to another VSO, but each time you have to file a new 2122 representative request, and then that will take the other one out. But you're not going to be working with two at the same time. Is it wiser to go through county VSO versus national? It's really up to you, and it's actually a hit or miss in any of them. I can't recommend to you any county VSO over a VFW or DAV because it's an individual type thing. The county VSOs are typically more stable. They've been in their jobs for a while. The nationals have a lot of turnover. Typically, they're young guys or gals that have gotten out of the service. They're not getting paid very much, But the nationals also do have, people have been there for a while and are very experienced. So it's really a hit or miss. I'm trying to help my younger brother, a Vietnam vet, to get Agent Orange disability. He's never filed and has several of the presumptive. The county VSO told him that's not part of his job. Wow, I can't. That's unbelievable. That county VSO should be reported. Yeah, county VSO should be able to help with an Agent Orange presumptive case. Again, to find any of I would try to find another county VSO, or go to the VFW, American Legion, DAV, Vietnam Vets websites and find where a local VSO would be. I certainly would recommend him to, if he's got some of the presumptives, he should be getting compensated. I retired 5 years ago. Was not provided an opportunity as a reservist to complete a retirement physical. The reservists don't coordinate or provide it. What can I do now? What can be done to support reservists in future retirement physicals? Well, there is a lot trying to be done. Reservists are now supposedly going to get DD-214s, which will help. But you don't have to have a retirement physical. to submit a VA disability claim. So you just need to gather your medical records that show things that happened to you while you're serving and submit a claim. Have you all heard why it's taking so long to process DD-214s prior to getting out, specifically Navy? I have not had that feedback. Good to know. I'm not sure why it would be taking longer time. I had mine before I left services. Are you saying that it's taking longer than you're not getting it before your actual out day? That would be unusual, but not that it couldn't happen. Are all the forms required on request for reevaluation increase in disability compensation or only for initial claim? No, a claim for increase, once you have your dependents and you have all those forms filled out, the only thing you need is the two ones that I highlighted in red, the 526EZ, or it depends on supplemental claims have supplemental forms. I didn't put those on the list, but there are additional forms. But it's typically you only use the 4138 and the supplemental claim form, which off the top of my head, that's a new form I haven't used. Are all the forms required for the 674 document college attendance for dependents? I have called in to do this. Is it better to do form to mail the form? No, the best way to do it is to upload it into your go on your va.gov account or have your VSO upload it into the system so that it's that it's in the system. You can mail it, however, it's just going to take it'll take upwards of 30 days before it's in the system because it goes to a contractor in Wisconsin to do so. Is dependent status required on all claim submissions if VA already recognized their status? No. Once you have your dependents are in the system, then no, you don't have to submit another 686C. You only have to update it if kids are going to school or when if they finish school early, then you use the 674. Or if you have a new child, you have a new child after you retire, then you would need to add them. But no. What if you have open heart surgery on active duty, which returns someone to normal? Is there disability associated with this, or will the VA not see it as disability because it's treated? It really depends on the surgery itself. Sometimes that will have a minimal rating because you had to have open heart surgery. But if you are considered totally normal, there's nothing wrong with your heart, then the surgery itself may give you a low rating, maybe 0%, maybe 10%. But it really will depend on what your state of your heart is right now. If my effective retirement date is January 2023, is base pay from 2023 used to calculate my retirement pay? Okay, this is not a VA question, but no, your high. I can't imagine, James, that you're not a high 3. So no, well, it should not. If your retirement date is actually the last day of the month that you retire for most officers, so it would probably be 31 December on your DD-214. We just say that, hey, that's the first day you're out. So no, your high 3 will be calculated from December of 2022 back. And which year's retirement COLA do I get in retirement? Okay. Again, this isn't a VA question, but you don't get COLA in the year of retirement, okay? The next year's COLA. So someone wrote a paper on that, the COLA trap, but because you've had a full year of 2022 of the ECI index, economic cost index, to your retired pay. Therefore, in 2024, you will not get a COLA increase. William, they are not top of the line, not even sure if they're online. Well, I've talked to a number of vets who are very happy with their hearing aids from the VA. Is VA healthcare only through VA facilities, i.e., if you're not near a VA? So the next slide I had, I don't know if you wrote this question, Brian, after I had the next slide, but no, if you're not near a VA facility or the VA can't see you within those timelines, 20 days and 28 days for specialty care, then you can be seen out in town. There may be co-pays out in town after a certain number of visits. I retired February 2022. I'm priority group 1. I just got my rating and already signed up for TRICARE Prime. Retired for myself, my wife, and 15-year-old. Can I use TRICARE Prime PCM to go to VA, or once I go to VA, I can never go? No, Mark, the VA and TRICARE are two distinct. They don't interact with each other. So you can go to the VA as much as you want. It doesn't affect your TRICARE. You can use TRICARE as much as you want, and it doesn't affect your VA. So they're two independent systems. Have you seen anyone get GI Bill to pay for executive education? If it's on, James, if it's on the VA's list of approved schools, whether it's OJT or whether it's a correspondence course, if it's on the list, if the VA has recognized it, then yes, you can use your GI Bill for that type of education. I left service in 2004 after my tour in Iraq. Is there any talk about trying to grandfather those of us that were in Guard and Reserves who never got to take advantage of it? I have a 1- and 4-year-old daughters. Unfortunately, Wade, no. They will not go back and grandfather for that prior service. Post 9/11 GI Bill, if you transfer some of your spouse and they do not want to use it, can you transfer back and use it? Kevin, the GI Bill benefit is always yours to take back until it's been used. So yes, if your spouse doesn't plan on using it, you can take it back. Before you, if you haven't left service, you can add, if you had children, you could spread it out to children. But once you leave service, you can only either take it back or switch it amongst folks who already had at least 1 month, with the exception of if you passed away, then your family can make some adjustments, or if a child or spouse that had the benefit passes away, then you can make adjustments. But otherwise, once you leave service, it can only be moved around to those who already had 1 month when you left, at least 1 month. I retired. Where am I going here? Sorry, I lost, it moved up on me. Okay. I retired in 2021, enrolled in BDD, and was rated 100% permanent total. Would my wife be eligible for DIC after 5 years instead? No, it's the rule is still, it's still 10 years for automatic entitlement to DIC. No, the refunding fee, no. If you hadn't submitted your claim before you close, then you don't get it back. Can't SGLI be extended for some period beyond retirement? Yes, it's not VA, but yes, it can be extended for a period. I don't have that detail in my head right now, though. Can VA funding fee be refunded retroactively? No, it cannot. VGLI, if you get it at age 55, does price stay the same your whole? No, each of those 5-year increments, it goes up. So every 5 years. So I actually had a MOAA member who was about to turn 75, and his basically was going to go up to the old rate. This was prior to the reduction. It was over $1,800. And he said, what should I do? And I said, well, do you still need $400,000 in life insurance at age 75? And he said, I thought about it and said, no, I probably don't. So he canceled it. Thanks, Richard. How often does VA call you back for a recheck after you get your rating, like 100% permanent total? Now, typically, if they've made a decision that you're 100% permanent total, they're not going to ask you back. And as I mentioned earlier, after age 50, or if your rating has been static for 5 years, then they're not going to go back and look at it unless you ask them for an increase. Then they will see, and they're never going to decrease it. They'll possibly increase it. The Social Security retirement reduced via compensation? No, it has nothing to do with it. Is bladder cancer included in the pact? I believe that was on the no, it was only kidney cancer and not bladder cancer. VA is changing sleep apnea and additional respiratory systems? Yes, they are, and they should be in play right now. confirming the max on a VA loan, 647. No, the National Capital Region, it was 970,000. So no, unless you already have an outstanding loan, then whatever's left on that outstanding loan would subtract from the 970 in the National Capital Region. Please clarify second VA home loan when you can only get a VA home you're going to live in. No, so if you've moved and you've kept a VA home, and you are renting it out, or you've let the buyer take over your loan, so then that loan is still outstanding to the VA. If you've paid it off, then fine, but then you have no limit. But if you still have a outstanding VA loan, and now you're moving because for whatever reasons, you can get a second one, but it will be deducted. The maximum limit will be deducted by what's left on the first loan. I think I'd explain that, Mary, again. So hopefully Web can. Well, Theodore, as I said, it's not going to be downloaded. You're going to have a link to the recording sent via an email. Okay. Okay, Deborah. How can you get a copy of DD-214 if you have misplaced yours? Are there things that the 214 copy cannot be used for? Deborah, I'm not 100% sure of that. I know that there's one that's supposed to be the primary, it's a -1 or -6, but you can go to the National Archives to get a copy. You can go through va.gov to get a copy. If you've sent in a VA claim, you can download it from the VA's website. From Peggy, that hysterectomies are 50%. Thank you, Peggy. Any idea how long it takes to process a presumptive illness claim? Well, the VA is supposed to prioritize for somebody who's terminally ill or homeless. So there are, if you put that information in your claim, if your VSO helps you put that information in, that's supposed to go to the top of the front of the line. But then typically, again, I had one of my first Agent Orange claims came back within a month. You know, it was just, I was floored. But I've seen others take a little while. So it really depends. I do have hearing aids provided by the VA, and they are fantastic. Thank you, Jennifer. What about ER urgent care visits for VA healthcare, i.e. you're traveling and away from VA facilities but have an emergency medical need? If you don't have other insurance, are you covered by the VA benefit? Yes, Brian, you should be. Thanks, Juan. Can a parent meet residency requirements for a VA home loan? Can a parent? Tracy, I'm not sure what you're asking there. The VA home loan guarantee benefit is for veterans or survives. There are certain conditions for a surviving spouse, but a parent, no, cannot get a VA home loan. Yes, Michael, if you're priority group 1, in certain cases, you can go on the VA's website and see if you're eligible for dental services, but you probably will be. If a vet is already rated 100% permanent total, can an additional claims be submitted for special compensation? Yes, there are special compensation ratings. Again, you've got to have a really, lost limbs, lost sight, lost hearing, those types of things. But yes, you can submit if other things, so that you're never going to get compensated for higher than the 100% unless you have that special compensation. And then there are special tables, and they have codes for those, S, L, I. So it really, you have to look at the special compensation tables. As 100% totally and permanently disabled for 5 years, my cardiac issues were found non-service connected. Subsequently, I had a heart attack. If I file a subsequent claim, is it limited only to the cardiology issue with a 100% rating? James, I'm not 100% sure on that. I think you need to go to a VSO and get advice from them, but I certainly would resubmit a claim and see where what it sends you up to. Okay, that was the last of the questions. I'm running out of my 90-minute time frame anyway. Thank you, everybody. Please submit the survey if you could. I appreciate you, everybody, tuning in and for asking all the good questions. Again, tune in to MOAA's next webinars that meet your needs. Have a good one.